Thank you, Chair. Mr Bowles, I refer the department to APRA's website. This pertains to physicians and the treatment of Lyme disease, where there are a number of doctors who treat Lyme-like patients who have had conditions placed on their registration, such as only prescribed medication in accordance with the Australian therapeutic guidelines. No Australian doctor can treat Lyme disease or Lyme-like illness in Australia and operate within the Australian therapeutic guidelines, even for a patient with overseas acquired borreliosis. Therefore, every Australian doctor prescribing the internationally recommended antibiotic treatment for Lyme disease is in contravention of the said guidelines. This situation, Mr Bowles, is unsustainable when thousands of very sick people are sick after a tick bite, but they improve when prescribed antibiotics. Given the Health Minister accepted the recommendations of the independent review of the National Registration and Accreditation Scheme for Health Professions, that APRA's responsiveness to consumers should be improved, could the department please advise what will be done to address this issue?
Senator, I might ask Professor Bagley or Dr Lyme to give you some more detail about some of the broader issues on this thing, because that is a very long and complex question. So, Professor Bagley, I might start with you.
Thank you. Chris Bagley, Chief Medical Officer. Senator, thank you for your questions, and I'm aware you had a long conversation with Martin Fletcher, the Chief Executive of AHPRA, on Monday, and covered a whole range of areas there. You have asked a lot of questions, and I might need to be reminded of one, but one in particular, you raised the point that borreliosis couldn't be treated by under a therapeutic guidelines, and Dr Lyme, Principal Medical Advisor within the Office of Health Protection, can provide advice on that one.
Thank you. Gary Lyme, Principal Medical Advisor, Office of Health Protection. Thank you, Senator Madigan, for the question. In terms of borreliosis, that is an infection caused by bacteria of the genus Borrelia. Certainly in Australia, we are able to treat that infection. If you're referring specifically to classical Lyme disease, we certainly do see patients with classical Lyme disease who have acquired it overseas, and we are definitely able to treat that. When it comes to the patients who are presenting with chronic debilitating symptoms, those particular patients, Senator, if they do have a confirmed infection caused by a Borrelia burgdorferi sensu-lato, then they can definitely be treated. For those patients, Senator, where the diagnosis is either difficult or in dispute, then trying to work out what is causing their illness is the nub of what the department is trying to do in its work with these particular patients.
At the previous Senate estimates, Dr Lyme, I raised my concerns about saying that doctors are being targeted and having restrictions placed on their ability to practice, and yourself and Professor Bagley assured me that this wasn't the case. Now, just recently we've had a doctor in Melbourne leading up to Christmas who've had conditions placed on his ability to practice and treat these people who are suffering from chronic disease symptoms. Could you inform me where these people are supposed to go when it seems that 7 doctors who've been identified across the country who these people go to seek treatment have been either knocked out or conditions placed on them severely restrict them from helping these people? And why is it a crime that these doctors are trying to help these people and give them relief?
Senator, perhaps I could take that. And as Mr Fletcher advised you on Monday, and important that the AHPRA or neither AHPRA nor the Medical Board are targeting doctors who are treating Lyme disease, and I know you had that discussion. What happens is when complaints are raised by members of the profession or the public to the Medical Board, then the Medical Board is obliged to investigate and according to its legislation and to take action as is required under their processes. So, and where these investigations have been raised, they've come through from, as I say, complaints that have been made. They're not being made de novo by the medical board. They're not being, doctors who they might hear about treating Lyme disease are not being targeted. And I think, Senator, you're aware of that. It is important, and to come back though to the important issue of the patients who are suffering these chronic debilitating illnesses. And this, there is no doubt, there is quite a division and certainly a weight of opinion on the side of the infectious diseases specialists and pathologists in this country that there is not likely to be a unitary cause for their condition. And so each patient will have to be considered on their own. And we are in discussions we've contacted our colleagues within the Department of Health and Human Services in Victoria, alerting them of this problem, and certainly there are some infectious diseases specialists who are having patients referred to them, and I'm not sure how many and what their treatment is required to be, but we think this is something that the public health system needs to engage with, because we are really concerned about these patients and their problems, as are you, Senator, and I respect that.
Professor Bagley, look, I appreciate your answer, but I note that you've pointed out to me that I had a meeting with APRA, but the said gentleman at APRA also told me that these doctors who've had conditions placed on their ability to practice can refer their patients on to other doctors. But they've been to countless doctors, and I've visited hundreds of people, I might add, Professor Bagley, in New South Wales, Victoria and Queensland, who say that they can't get treatment, and the doctors who treat them and treat them successfully are being knocked out. So who on earth are these doctors supposed to refer them to? And these people have been to countless specialists and GPs and received no treatment.
I think this gets really to the nub of the problem, Senator, because we have, when these patients are referred to our leading specialists, infectious diseases specialists in this country, with whom we trust the management of all infectious diseases in any other setting, these specialists are still requiring and needing more evidence than we have now that what they're being asked to treat is in fact Lyme disease. We are working, and we have worked over the last 3 years, trying to bring together, because we can't get in the middle of that doctor-patient relationship, and it's not our role, but it is our role to point out to the medical community more broadly that they have patients who have real problems, who need care, and we need them to work together to come to a solution for these patients with major problems. If a leading specialist in infectious diseases has a patient in front of them, looks at all the evidence they have and doesn't believe they have Lyme disease or a Lyme-like illness or something that requires intravenous antibiotics for a very long time, then we can't say, but you must treat that. We trust them, and we trust them in all other cases. But it does come back to the fact that there are many patients, and I receive petitions online. I receive letters from this doctor's patients from Victoria, where you read of patients who have been quite unwell, who have been given treatment, which is complex treatment, antibiotics intravenously often over a long period of time, plus other treatment, and who do feel better and who do come good. And then they're really concerned that by not having access to that doctor and his treatment regime, then they're not going to, they're going to deteriorate, and some believe they already have. And that's a problem. But it's going to be solved by bringing people together. Now, the issue of the specific practices of some of these doctors, which may or may not relate to the treatment of Lyme disease or how they treat it, or could be other factors, this isn't the place to go into that.
Thank you, Professor Bagley. But it still doesn't answer the question for these people who are suffering. And if you'd personally visited people like I have in their homes and spoken to their families, none of what we were told at the previous Senate estimates or what you've told me now will deliver any comfort or any solutions for these people. Like, the rhetoric and the reality at the coalface don't marry up.
Well, Senator, I think the way forward for these patients, and I am aware of how you've described the treatment of some of these patients being treated by other doctors as being treated worse than mongrel dogs with mange, and that isn't going to help either. I think what we need to do is to look to have a multi-disciplinary approach to these people, get our
When's
best
it going to
brains
happen,
together.
Professor Bagley? In the meantime, these people are suffering. Their families are going to hell in a handcart.
I understand that.
And all they're getting is lip service.
Well, what would you have happened, Senator? I realise you asked me the questions, but I know that's a question that was asked of you a few days ago.
Well, Professor Bagley, I'm not a GP, I'm not a specialist. You're a professor. Dr. Lum's an expert in his field. But these people are suffering, and I can't ignore that. And I'm asking you, what is practically being done to address these people's illness?
Senator,
Rather than just telling them to, go away and roll up in the corner and die, what is the department proposing to do to get some positive outcomes for these people?
the department, Senator, again, doesn't manage the clinical conditions or the clinical treatment of individual patients. We work with, and we've been in contact with, the Department of Health and Human Services in Victoria, pointing out precisely the problem that you've pointed out. We've asked, and we've been in contact with at least one specialist who also is looking for similar help. So no one wants to abandon these people. No one is saying they should be put in a corner and dying, but we come back to a fundamental issue that has been, not just in this country, but around the world, of the treatment of people with chronic symptoms as a result, in most cases or many cases, of a tick bite. And there are some doctors who believe that this is a Lyme-like disease and long-term antibiotics is a problem. There is no, and we do have this doctor in Victoria who has restrictions on his practice, and this does provide a problem. We are hoping that through working with Victoria and the specialist community there, that those people working together will come up with an answer.
Thank you, Professor Bagley. Thank you, Chair.
Thank you. Just a brief one from Senator